Okay, it is 10:03 and we've got a good amount of folks on. I want to be mindful of everyone's time. So today is fifth Wednesday for the month of September, and we have advanced pretty quickly through this year. I hope everybody is doing well. Still thinking about folks in Region 5. If they've been able to join, welcome. I hope things are going okay for you. Today we are launching into what we've heard from many regions, which is a refresher of a lot of the services that we provide in the health units, kind of in preparation for maybe moving back to more in-person services as we move through the coming weeks. So welcome to today's clinical refresher training. We do have some updates also that we'll be sharing with you. And again, for those that don't already know me, my name is Deborah Even. I'm the Chief Public Health Nurse, and I will turn it over to my colleague to run through the specifics on what we'll be covering today. Thank you for being here.
Hey, good morning, everyone. It's Daniela Wilson. I'm the Clinical Systems Support Manager, also known as the Electronic Health Manager for OPH. So just to reinforce what Deborah said, the items we're covering today are a collection of areas of improvement that have been identified by either audits that we've performed or concerns mentioned by regional leadership, or we've received some great feedback from super users. So I wanted to highlight how the objectives for the training are identified and encourage you to use your super users as not only a resource, but a way to, I'm reading chat, sorry, making sure the echo's not too bad. And not only as a resource, but just a way to get meaningful and on-time training for items of interest to you. So we're gonna do a refresher on how to request a new user account. That's one that we continue to get over and over. Also, help desk process, we're gonna refresh you guys on that. There's an application error that many of you guys are getting, so we're gonna cover how to get out of that one. Entergy version 12.10 release is coming, and so we want to get ready for that. We're going to do a Moodle refresher because we're super excited about that platform, and so we want to make sure that everyone knows how to get there and what to do once they're there. Reproductive Health is going to do a refresher. TB is doing a refresher. CYSHCN is doing a refresher, and we have one for immunization. And so let's get started.
Good morning, this is Laura Austin. I'm going to give you a brief review of requesting a new user account. We have moved the instructions for requesting a user account as well as all the forms into Moodle. They're located both in the clinical and clerical modules. There is a document in Moodle called Requesting Accounts. It also contains a link for you to use to be able to request an account for Moodle for your new users. So my recommendation is supervisors should take a look at this instruction document. It's the first document in the list under user request forms. And it has a link in that document to the SOP for credentialing. In addition, it has the link, as I said, to request an account for Moodle. And then it contains the instructions for how to use the new requesting EHR user account form and the process for electronically signing that. So all of that information is now located in Moodle for you. So that is where you can retrieve the instructions for requesting accounts as well as the forms specific to your region.
Good morning, everyone. So I just wanted to take a second and review all of the various ways that you can go about requesting help. For things such as basic computer functions, the computer won't turn on, having monitor issues, something that exists outside of Entergy, you're going to go ahead and you're just going to go straight to creating a help desk ticket. If you are locked out of your computer or Entergy/CITRIX, or need some kind of a password reset, once again, just create a help desk ticket. Slow internet connections or your internet is down, also, once again, you will create a help desk ticket. There are multiple ways in which you can create a help desk ticket. You can either submit them online at http://otssupportla.gov. Call one of the two numbers, both end in 6900, So pretty easy to remember. Or you can email otsupport@la.gov. For patient merging, there are certain things that have to take place before you're able to create a help desk ticket. The user guide has those steps that must be completed before you are submitting a ticket. If you do not do those steps before you submit a ticket, we will contact you and say you must do these things before you submit your help desk ticket. So help us help you by taking care of those particular items that are required in order for us to get patient merge. Once again, those are found in your user guide. Scanner issues. I know a lot of you are having scanner issues. I have created a scanner workaround that can be found on Moodle. I gave it to Tammy. She placed it on Moodle. Please use that workaround. I understand that some of you are able to use the scanners directly in Entergy some of the time, and then you encounter problems, and you ask us to fix it. We have created this workaround. This is the only way that we have to ensure that images scanned in will always make it into the EHR without a problem. So please, please, please consult that workaround, which can be found on Moodle. If for some reason that workaround does not work, that typically indicates that it is an issue with your user, and then we just have to create a help desk ticket with Greenway to resolve that. But those are exceedingly rare. Most of the time, the issue is going to be that you are not following one of the steps in the workaround. So please, once again, consult that workaround. Requesting a new user, you must complete the new user request form. Those can also be found on Moodle. They will be routed to the appropriate RAMs for approval, and then we will get them and make that new user. Please do not email me and just say, I need a new user, here's their name. Because I'm going to email you right back and say, please complete the required new user form. Next slide. Now, for voiding encounters, go to your user guide. Your user guide has all of the necessary steps to do that. If for some reason you're having problems, consult your super user. They're going to be able to help you. Either in clarification in using that user guide, or they'll already have it down pat. That's our hope anyway. If for some reason neither the user guide nor the super user are able to fully help you in that, there may be a problem, and that's when you would need to create a help desk ticket. But once again, that user guide is going to be your go-to, and 9 times out of 10, it's going to have everything you need to take care of voiding your encounter. And lastly, anything that I have not listed so far. This is kind of our catch-all. First, consult your user guide. Once again, that's always your go-to. If for some reason you can't find it there, go to your super user. They will then, go to your regional nurse manager, and we will reference back the communications flow, which Deborah has already mentioned. That way, anything that we are discovering, be it a new and better way to do something or a problem that for some reason has slipped by us, we will be able to address it globally rather than one. Once again, 3 different ways to reach your help desk. You can submit a ticket online at otsla.gov. You can do it via email, otsupport@la.gov, or you can do it over the phone, 219-6900 or 1-888-219-6900.
Good morning, this is Laura again. We have seen a lot of tickets and emails regarding this parameter not valid error. When you try to access a chart on the EHR side, when you see this error, you click on the OK and it will close out the EHR. This is a known issue with Greenway, and it's actually caused by an issue with a scan of an ID card or an insurance card on the practice management side. Next slide, please. When an ID card is scanned into the practice management patient administration side, if it is not in JPEG format, it will not only not display, but it will cause this parameter error. The way to resolve this is to actually open the scan ID card. You will have to click on the back version, go back to the front, and the delete will be available. That scan will have to be deleted because it's technically to the system, it is empty. If you do not have the ability to delete it, you will need to put in a help desk ticket and request that we delete that scan for you. But anytime you receive a scan of an ID card and it's in, for example, PDF format, that needs to be uploaded just like an image into Image Manager under the folder for front desk documents, because you cannot use a PDF under the photo ID scan in patient administration. The only acceptable format for these scans is JPEG. When it's not scanned in as a JPEG, it will cause that parameter not valid error, and the chart will continually crash until that scan is removed. I know that we have seen a lot of these, and as I said, this is a known issue. So please check for a bad scan on the photo ID and either have someone delete that for you or send it into the help desk if you do not have the ability to delete it. All right, next slide. Entergy version 12.10. We are currently scheduled to go to version 12.10 next Wednesday. That is a confirmed date at this point. That doesn't mean it won't change, but for right now, we are expecting to move to version 12.10 of Entergy next Wednesday. One of the, there are several updates to the system that you will see on the EHR side. One of them is the ability now to make a diagnosis primary. If you have a diagnosis code that's listed second and you want to make that primary, you will now be able to right click on it and make it the primary CQM diagnosis code. It's simply a right click, make primary, and then validate by saying yes. And that will make it show up in italics, so that tells you which one is the primary. Next slide. Another change you will see in 12.10 is until 12.10 comes out, the DUR for manually entered drugs was not always checking automatically as it should. So the solution Greenway has put in place for 12.10 is a warning screen that notifies the user that you will need to manually check that medication against others you are prescribing because the system is not running the DUR. In addition, the drug allergy description, which used to contain the drug name, strength, form, and route, has been shortened. Now the system will only show the description of the simplified drug name, and anything you add new for allergies will be saved as well, only with the drug name for that select allergy screen. Next slide. Another change you will see is the ability to edit an allergy. You can actually change the onset date and time as well as the resolved date and time. If it is an active allergy, you can change your onset date and time if needed. This will always default to the current date and time. In addition, if you need to change or add a different date or time for a resolved allergy, you set your status to resolved, and that will allow you to edit the resolved date and time on that same edit patient allergy screen. Next slide. They have also added the ability to edit dates and times for your flow tracking. So if, for example, you forgot to move a patient to, for example, ready to go, you can actually edit that time to show when the patient actually moved to checkout. Same thing for encounter end times. They're now allowing you to edit the time for the end of your encounter event. In addition, a few other changes. They have removed the de-identify patient checkbox from your printing patient charts. They have discovered that that did not work as intended, and it was not accurately de-identifying a record. So it is now going to be a manual process. If you need to de-identify a patient record, once you print it, you will have to do that manually. They are removing that checkbox completely. They have also updated the size of the immunization details VIS window. They've made it larger, so to prevent as much scrolling to see the document. And they have also removed the ability entirely from practice management to do prescription entry. Probably not something anyone's used, but it actually existed on that side, and it was not set up to run DURs and other things needed for the EHR side. So they just removed it completely from practice management. Next slide. There are a couple things that they have added that we are asking you to not use. First one is on your order status. They're now going to provide a checkbox that says close order not performed. You will see the checkbox on your lab order screen, but do not use this. We will be testing this once we have moved to 12.10, but because we have such specialized lab setups, we don't want to use it without testing the functionality to ensure that it doesn't create other problems for us. So for right now, even though you see that box, do not use it. Continue to use the workflow you have always used for not performed labs. In addition, they are implementing confidential item level segmentation. They're allowing you to mark certain items confidential. For example, instead of marking the entire chart confidential, you can currently mark problems as confidential. We will not be using this feature. It is not completely functional. It does not respect confidentiality for many features such as CCDs and interoperability features, exchange documents, immunization registries, etc. And it also is not effective for the practice management side. Anything you mark as confidential will still come across and be seen on the practice management side. So at this time, we will not be using this feature as well, even though it exists. So please do not use the item level segmentation confidentiality feature. It will exist once 12.10 comes live. We cannot turn it off, but we ask that you not use it. Next slide. Another change you will see is there's finally a warning if someone else is in an encounter note. It will notify you when you try to open the note that someone else is editing it. This gives you the option to say no and wait until the person editing that note is finished. You can, of course, still access it, but it's warning you that the changes you write or you make may be overwritten. So it's best if you get the notice that someone else is in that note, you wait and let them complete their changes before you make edits. Next slide. And for any additional Entergy 12.10 information, there's online help and technical documents that you can find. Here on this slide is a link to the online help that is available for version 12. In addition, there is a video course for Entergy 12.10 release readiness, and that can be found in VIA. There is a link to it on this slide as well. Next slide.
So hello everyone, this is Tammy Bennett. We're going to be playing a video to go over just a little bit of changes about Moodle. So here we go. Hi everyone and welcome to the Moodle Refresher. My name is Tammy Bennett and I'm the Reproductive Health Statewide Nurse Consultant. Today I wanted to give a couple reminders about different websites. Moodle is a web-based platform, so you can access it from any computer using this website address. The other thing is Moodle, if you are not understanding how to complete modules, how to log in, how to view your dashboard, I would encourage you to go to YouTube and watch this video. It's all about how to do Moodle and how to complete your modules. For any regional leadership staff or nursing supervisors, clerical supervisors, if you get a new staff person in, then you can use this website to let us know if they need Moodle access and if they need RedCap access. All right, for completion requirements in Moodle, after each training, recordings will be uploaded to Moodle. As we upload new things into Moodle, we will send you an email to your inbox stating that blank new training has been added. Please go and attest that you have completed. You will have 2 weeks to complete this module. If you attended live, just go in and mark the checkbox that you attended this live, and you don't have to watch the recording. However, for whatever reason you were not here live, you did not get an opportunity to participate, then go in, watch the video, and mark the checkbox for attestation that you watched it and you understand what was presented. If for whatever reason you do not understand what was presented, please go to your supervisor for clarification before you check the checkbox. So every month we're going to be pulling incomplete data, and we're going to change this up a little bit. What we used to do was put all of the incomplete data into a roster and mail it out to the regional leadership teams. But we found that if I can send you individual emails for those modules that you've not completed, you might have just missed one checkbox, or you may have uploaded the file but not clicked the checkbox. So if you do get that email, please go into the module listed and make sure that all the checkboxes are completed. If you don't do that within the next few days, then your name will go to the regional leadership teams, and we're going to ask that those regional leadership teams help us with obtaining compliance from all of the participants on the required modules. There are now some non-Title X modules added to Moodle, and those involve the EHR, clerical, clinical, standard operating procedures. There is a video resource library, telemedicine policy and procedures, along with, if you are a Title X staff, you will see those on your dashboard as well. So looking at all of these other modules, I have also listed who is supposed to be enrolled in each of those. If for whatever reason you are, let's say, a clerical person, but somehow you got enrolled into the clinical, please let me know so that I can fix that, so that you have what you need. Again, this is saying if there's a module that doesn't apply to your role, please let me know. And to let me know, you can email me and along with this following information, and then I'll research and provide further guidance.
So we'll take some questions and answers into the chat box. If you have any questions, please put it in there and we will answer anything before we complete the segment today. There are a couple reproductive health workflow refreshers. The first thing that you're going to find is if you work with another provider, you will have been issued a secondary login already. But just so that you know, when do you use the primary login and secondary? So the primary is the login that you were issued whenever we went live with EHR, or the first login that you got when you were hired. And it's the one that identifies you on the backside as a clinician, either an RN, APRN, or an MD. You will use this primary login when you're the highest level provider for that record. So in other words, if you're the one that's going to be signing off the note, doing the orders and charges, then you're the one that's going to be signed in as the primary provider on that record. The primary account will be just your name, and it will display just your name. The secondary login was issued for all of those nurses that assist APRNs or MDs in their in-person clinics. You'll use the secondary login whenever you're working with that nurse practitioner or MD, because the nurse practitioner and MD are the highest level provider on that record. This allows you to assist them and put in the history and the orders, but the orders are actually going to be billed under that provider, not you as the clinician. So use your secondary account whenever you're working in a clinic with a nurse practitioner or provider. And that secondary account will have AP behind your name for assisting provider. One of the things that we wanted to put in the manual that's changed is the CITRIX login. It's now a passphrase that can use spaces, like I like crafts with spaces between, and that passphrase is good for a year. So the first time you log in, you're going to be asked to set up security questions, and these security questions will be used if for whatever reason you forget your password. You can click on Forgot Password, which is going to be right here, and it'll take you to those series of questions so that you can reset your password. The Entergy system login, whether you're logging into the EHR or to base Entergy, that's still the same. It's going to be your username along with the password that has to have, upper or lower case and special character. One of the time savers that you may want to use in your clinic is, instead of Xing out with the big X and taking you out of Entergy EHR completely, is to just hit change user, and you're going to find that at the top right of your screen. If you change user, it takes you back to this login screen where someone else can log in with their information, and you don't have to go through the whole process all over again. So before your first client's arrival, the thing that we need to do is open EHR and view your main page. I also call that my to-do page. You can work your task, work your orders, and under the orders, since we're using primary and secondary logins, very important to look under you as the provider to see what labs you've ordered, maybe what labs have come back that you need to close. And then you also need to select the provider that you worked with to work their orders, because the ones you may have clicked when you were using that secondary login, they actually went under that nurse practitioner or physician's name. We're going to go through this on a quick demo, but you'll also toggle down and look for those orders that have been resulted. Go in and close those that are negative. You're going to do your positive workflow for those orders that are positive. And then if any are red, indicating they're over 2 weeks old, you're going to follow up and find out where that lab or order is.
Once you log on to the Entergy EHR, then it should come up to your My Day summary page. From this point, this is what I call my to-do page, because it will tell me the appointments that are scheduled. It will also tell me the appointments that are here. It will say the tasks that I have that I've done. It'll also give me all of the open notes that need to be reviewed and signed off. If your landing page for the My Day summary does not look like this, you will need to go into your preferences and make sure that you have checked to show open notes on your My Day. So while you're waiting on your first patient to be registered, what you can do is you can go and work some My Task. You can work it from either the dark side on this side, or you can work it from this pane. There's multiple ways to get to different functions within the system. The other thing that we need you to do is go into orders. So if you will remember, back in the day, we used to have a logbook of all of the orders that we sent, and we kept up with these to make sure that we got those results back and that any positives were followed up on. And this is your digital order book. You can toggle by different providers, all of this. Whenever you are the highest level provider of that encounter, so say you are a nurse and you're doing an STD visit in the health unit and you're going to sign off that note, you're using your primary login. All of the orders that are done off your primary login are going to be here. However, if you are working as assisting provider and using that secondary login, then you're going to have to go to that other provider, say whatever nurse practitioner or physician that you're working with, in order to see those orders, to see what needs to come back or view what has come back. Look at this due date. Anything that's over 2 weeks old will show in red. And so if anything's in red, you'll need to follow up with either star limbs, maybe manually pull off the report, or find where that order was. If the order was not done for whatever reason, then you can right-click and you can void that order and say, unable to obtain specimen, whatever, lab rejection, whatever you have. On the orders that you have, the next thing you need to do is look for those that have already been resulted. If they've been resulted, then we need to close out those orders to get them off this list. You can toggle by status and say resulted, and that's going to pop up all of these that we need to look through. So you'll look at the bottom. You can see the image result. You may have to click on it to see. Now this is a test patient. It's not going to actually come up with that image, but click on the image, make sure it was normal and it was negative. And at that point, you can go down here at the bottom and close the order, or you can double click into it and then you can close it here and hit save. For any of the positive labs, you will want to, of course, follow the positive lab workflow and send this, task this to whoever in your clinic follows up with those positives, sees if they were treated, calls them in, documents, on a non-billable, the conversation. And then once they're treated, you will go ahead and close that order. So going again, you will click on it. You will be able to see the image here at the bottom. You can click on that image and it will come up with the result. Of course, this is a test patient. It's not going to do it. But once you view that image, you verify that it's negative, you can go ahead and close the order here, which is easier just working in the same pane, or you can double click it and close the order here and hit save. All right, so that is all about orders. You can also see the ones that have been ordered by toggling, and then you can say over here on the right, the ones that are due only. So all of the ones that are over 2 weeks will pop up. So you don't have to weed through all of them, only the ones that are delinquent. So here on our list, we now see when a patient has arrived and been checked in. You can click the blue hyperlink to then go into the record, go ahead and do your chart review. In order to do your chart review, one of the easiest ways is to go to vitals. You can view all of your vitals along with the weight to view any trends. Then you can go to administered medications to see what medication they're on, whether it be a LARC or the depot, and also see when the last dose was. And then for labs, you can't go to this tab just yet because we are not interfaced with our lab. You must go to patient encounters, pull up that patient encounter, and then if there are any orders, you will see them here under orders task. There will also be a blue hyperlink here you can click on to view those results. So that is one of the easiest ways to find your last lab. Once the patient is checked in, the note is already going to be created. You'll click on it. And the first thing you're going to do is when you call the patient in, you're going to go ahead and update the medication list. Make sure everything is current. And let's say that we need to discontinue something because they got a LARC now. You can say now has LARC and just update this medication list to make sure that what they have here is actually what they're on. Once you do that, mark as reconciled. That means you have gone over this list with the patient and everything here is accurate and up to date. For allergies, same thing. You will go through here, and once you review this with the patient, you will mark it as reviewed. The next step will be to go to your note and document your vitals and your chief complaint. And put in your vitals and height and weight. And save. And then you can go into your form that you're going to use. So click Forms. Go to Shared. And if you're using anything reproductive health, you're going to always go with this one. If you're doing a telemedicine visit, it's going to be either the male or female telehealth. For nurse workflow, though, it's always going to be this top RH clinical form. We have moved the QFP type of visits to the front page because we've also added this lab-only visit encounter type and the follow-up note type. So depending on what the patient is here for, you go ahead and select the appropriate gender identification and what QFP visit they're here for. For the history part A, what you can do is you can split your screen. You can go to your last encounter and you can review that history. All right, in reviewing the history with that patient and you see that nothing has changed, take a note of what date this was. You can bypass then the history part A and go straight to part B. You can rejoin your screen so it's larger. And you're going to say nothing has changed on your history and go ahead and put in your date. This history was reviewed, the history that was reviewed with the patient was on the 18th or whatever date. If you have to follow up on any appointments, like we've ordered a colpo or a mammogram or whatever, you can click here and you can say pending appointment for colpo, whatever you need to say. Or you can say no show, rescheduled, whatever you need there. At this point, this is the same workflow that we've been doing. You will continue to go through the appropriate tabs based on and complete it based on the requirements for that type of visit according to QFP. Just as a reminder, if you ever wonder what absolutely has to be documented, everybody should have a copy of this in their clinics. This is the checklist for the different types of services. This one is for women, the next one is for men and their type of services. And if that section is required according to the Quality Family Planning Guidelines. And this is what we base our documentation on, as well as the chart audits, to ensure that if it is required, we are completing it in the EHR. Just to let you know also, there is a QFP app, not only for the desktop, but also for your iPhone. If you would like, it makes it easy just to click it up, make sure that you are documenting the correct things for that type of service for male and female. Going back to our electronic health record, you would also document your exam, A and B. And then as a nurse, you're going to come here, you're going to select the appropriate ICD-10 code, as well as any high-risk sexual behavior codes, which will flow automatically into the orders and charges card. Make sure you also continue to fill out your end of contraceptive method any counseling provided, and at the very bottom, click here that you have reviewed all this with the patient, the questions were answered, and instructed to call the health unit if any questions. Remember that if you do a pap smear, to check here, yes, and you'll have to go in later after that pap smear returns to document the results of that pap. You can go ahead and save your documentation and then go into your orders charges cart. Once you go into your cart, you will see all of the diagnoses that were selected on the template have flowed over. One of the things that is coming is the identification of the primary diagnosis. When the new update for Entergy rolls out, you will select the primary diagnosis, right-click, and it will say Make Primary Diagnosis. Because that upgrade hasn't happened, I can't show you, but just remember you will be able to right-click whatever you decide is going to be your primary diagnosis. The next thing you want to do on the orders charges card is always start left to right. This prescription tab is only for APRNs and MDs. Labs is going to be used after we become interfaced with our electronic health record. Remember how I said earlier you can task for multiple screens? This is another way to task something. Charges, make sure you charge for your time first. This list will be your nursing E&M codes, be it your 99211 or your T1001. Select whichever appropriate for that visit. OPH labs are all those send-off labs as well as the point of care labs. Please make sure you select any of those. Go under the high-risk heterosexual behavior, order one at a time, and save between. That way, if something is rejected from the lab, then we can cancel or void just that one order and not have to void the entire requisition and then reorder. For point of care labs, click on the point of care, go ahead and result it immediately, and close that order. Once you hit OK, because the order has been resulted, it's going to drop your charge. This outside lab is mainly used for other programs such as CYSHCN, TB. I do have the HPV typing and PAP under outside lab because that is a send-off, and we do not charge for that lab. CDD charges for that lab. Go over to procedure, and if you have any reproductive health procedures, you will find that at the bottom. The one we have listed is expedited partner therapy, which is used by APRNs. If you are making any referrals, this is where that will come up. I noted that this patient had an elevated blood pressure, so we will need to go ahead and refer to the primary care provider for blood pressure. Select that. Once you hit save, it's going to come up with the correct referral form. You will preview that form. You can hit edit, and then you can complete the referral form here. Once you complete this form, save it, and you can hit OK to print and hand it to the patient. Okay, if you do have any patients that require mandatory reporting, I have already put in the DCFS reporting form here. And when you open this up, it will give you further instructions on how to report, whether you need to call them at the 1-800 number or if you can send in this online form. Reproductive health medications. If you will remember this tab as anytime you open that stock cabinet to grab something out of the stock inventory, you're going to need to go here to select what you have given. And then you're going to go here to administer that medication that you just gave. And this is where you would document also your lot number and expiration date, site, route, all of that. Reproductive health supplies is where your condoms, foam, and film are. And once you finish with your orders charges card, hit save. And then go back to your note, and you can go ahead and sign this off if you are done. And sign it off, sign. Don't be afraid to go ahead and sign off your note, because you can always go back and you can open this back up and amend it if you forgot to document something. So don't be afraid to go ahead and sign it off. Putting it into the signed off mode, make sure that nobody can go in and change your documentation. The next thing I'd like to show you is the new PH 415 form that everyone should have. As a reminder, anytime you give any medications to someone who does have insurance, go ahead and complete the PH 415, and you will send this to Leah. Whatever you give, you're going to want to check that box depending on the dosage and how many that you gave. So pretty easy. And then you go ahead and fill out the top, put the patient label, and then make sure you put the barcode label on the sheet. Not only does this work to replace your stock, but they also bill for that medication. One of the last things that you're going to do now is you're going to go over to the problem list and make sure that this problem list is updated. You can go to your orders charges screen, and any problems that you have here, you can right-click it and copy it to the problem list. So that when you do go to the problem list, you can right-click it, hit Patient Education. It takes you into Medline. This is required for APRNs and MDs for meaningful use. After you look at the patient education, it's going to ask if you want to send this to the patient's portal. And if they have signed up for the portal, that is what is recommended. You hit yes, and it goes to the portal. If the patient has not signed up for the portal, it's going to give you the option to print it so they can leave with their patient education. After you complete the patient education, you should be done with this encounter. The orders charges are signed off, note is signed off, problem list is updated, and patient education is done. So therefore, you can X out of the patient and mark that patient out.
A quick reminder, whenever we do get those labs back, when you're scanning in the labs, make sure that you're linking the correct encounter to it, as well as changing that reference date. If you do not change the reference date, it defaults to the same day that you're scanning in the lab, and then it looks like on the billing side that that lab was done on the day you're scanning it in, and insurance is denying those claims. So what we have to do is make sure that this reference date is actually referencing the date that this lab was done. Again, make sure you also attach it to the open order. So once you scan and you change it, you link it to your encounter and you change it to that date that it was done, you save it, and then you attach it to that open order. That will allow the patient charges to drop, and it will also flow over to the order screen and show that it's been resulted.
So there's a couple of questions in the chat. So the first one came from Sarah regarding the secondary login. And so as Tammy explained, you'll use that secondary one when you're assisting a provider. Now everyone does have one assigned. We haven't quote unquote made that live. We have had a number of you, and I thank all of you that have tested these out for us. And so the reason that there's a secondary login that you need to use when you are assisting a provider is because if you order something under your own initial or primary, what we're calling primary login, it will drop the charges under your name, even if you're assisting the APRN. So that will probably go live for you all next week. You'll receive an email detailing how to enter that. and hopefully we can add a little paragraph in there just reminding you when to use it. The second thing, Tammy, for private insurance, came from Jessica. What documents should be attached to the PH415? Copy of the insurance card. They're currently attaching the Medicaid MEV sheet for those with Medicaid. Is there anything else, or is it just MEVs
Yeah,
is
that's
okay?
it. That's it. Yeah, Leah would love to, if we have the MEVs, to go ahead and print that out and send that with the PH415. So yes, if you
So
can
they
do
don't
that. Mhm.
they don't need the insurance card. The MEVs is sufficient, right?
Correct. And
Yeah.
I will check with Leah just to be on the safe side, but I believe she said that she can look inside the EHR and that information comes over so that she can view it. But I'll make sure and make sure that's correct.
Follow-up question from that: is there a MEVs for private insurance?
So
Don't
MEVS is only for Medicaid.
Yeah.
But when you run the eligibility on private insurance, it does come up with that eligibility verification, which can be printed.
Correct. Let's see, there's another question from Andrea. Is there a way to see what or if the education, what was sent to the patient? Let's see, Laura noted that that goes to the patient portal. Patient education sends on the encounter summary to portal. It doesn't send until the note has been signed. Right. I think we could turn this over to our colleague, Angela Blanchard, with the TB program then for a TB refresher.
I just have a few things to review. Most of them are about new appointments. I don't know if you noticed, if you've gone into forms and saw that I created an electronic TB9 form. This is the exact same form as the draft TB9, and you can start using that one. I just want to make sure that it works without any glitches for a couple of weeks. Please let me know if you see anything that shouldn't be happening. And once we know that it's running smoothly, we're going to delete the draft TB9 form. So this is new appointment types for TB. We have immigration and refugee appointment types that do and that do not fall under the tuberculosis program. These two are new appointment types that fall under the TB program. The TB lab only visit is not new. It's been around for a little while, but the abbreviation, the appointment code changed. Previously it was NSE. Now the abbreviation, the appointment code is TB lab. These are labs that are not, encounters rather, that are not affiliated with a nurse encounter. So you're not going to have an E&M code. And some of the examples that might be like a repeat T-spot for a borderline result, or if a patient comes in and drops off a sputum and you just need to enter the sputum specimens. So your orders and charges are always going to have a diagnosis and the lab that you did that day. And a TB radiology only new appointment type, it's under TBCXR as the appointment code. We have standing orders that are coming out in the very near future where nurses are going to be able to order x-rays, and DIS will also be able to, and when I say order, enter the order in Entergy. So that's also not a nurse visit, so you're not going to have an E&M code. And some types of examples are if the doctor is not able to come into clinic and you can get the patient in for the chest x-ray and the doctor will record review it off site. Or if you have a large group of high-risk contacts that need x-rays, you can get them in and have your tech run x-rays on all of those prior to clinic for the doctor to review. And again, those do not have an E&M code. You will need a diagnosis code and the correct chest x-ray chosen under procedure. So just for clarification on foreign-born population and appointment types. So EDN is an electronic disease notification that TBDIS receives from the U.S. Refugee Admission Program. These are immigrants and refugees at the border who are found to be high risk for certain disease conditions that need to be followed up on, one of which is tuberculosis. So when they come across someone who's high risk for infectious active TB, an EDN is sent to TBDIS. Then they're going to notify the clerk to schedule an appointment for an EDN. OPH is mandated to evaluate these refugees and immigrants that come in, and an EDN is sent, and it is in a timely manner. A nurse visit needs to be within 30 days, and the doctor's evaluation needs to be within 45 days. So we need to get on it as soon as we get those notifications in. If you have any questions, you can call me, or I put a link at the bottom to the guidelines for EDNs. So these are the two appointment types, new appointment types that do fall under the tuberculosis program is electronic disease notification nurse visit, and that's for the initial nurse visit to work the patient up for the doctor to evaluate. And we have a separate one, TB electronic disease notification medical visit. That's when the patient comes in for the medical evaluation. These are covered under the TB program because, like I said, we are mandated to evaluate, having a medical evaluation on these people. And we have to give feedback to the U.S. Refugee Program. So a couple of other new appointment types that do fall under the tuberculosis program. And a lot of you may not have heard of this yet. It's only a pilot program in regions 4 and 9. Is the Foreign Born Outreach Initiative that the TB program started almost 2 years ago. The appointment code for that is TBFBO, Foreign Born Outreach. So basically what the program is anyone that is in a public health unit who identifies themselves as being foreign born should be offered a free T-spot and an understanding that if it's positive, we will give free medical evaluation and follow up to them. And I would like to say that a lot of people are fearful of being reported. They think they're going to get in trouble. They're very apprehensive for this test. Reassure them that they're not going to be reported for anything. We just want to screen them to make sure that they don't have TB. These do fall under the TB program. And it's also, this is one of the only things that's still on hold due to COVID, so we're not doing those yet. Now I want to clarify the difference between a refugee and an immigrant. A refugee is a person who flees their country. They're unable or unwilling to return to their country due to fear of persecution based on their race, religion, nationality, or being a member of a social group. Someone who has fearfully fled their country because they fear the threat of persecution. The United States grants these refugees asylum, protection from their country. There is a refugee assistance program that is a program of the state. An immigrant, however, is someone who chooses to resettle in another country. They leave their country voluntarily, enter the United States with a visa with the intent to permanently reside and work here. Immigrants, the immigration appointments do not fall under the TB program. So these two appointment types do not fall exclusively under the TB program. And this is what I wanted to point out, because apparently immigrants and refugees have been appointed in a multitude of different ways, most of which were TB initial visits. Some of them were appointed as immunization appointments, and some of them were appointed as reproductive health appointments. We had a few that were even appointed as immigration appointments. So if they're a refugee, the appointment is going to be a Refugee Medical Assistance Program. The appointment code is RMA. So basically, this is a refugee health screening. Even though this appointment type doesn't fall exclusively under the TB program, we cover the cost of the T-spot, but the T-spot only. The Refugee Medical Assistance Program is affiliated with Catholic Charities, Medicaid, and Office of Public Health that cover refugee screenings, other refugee screenings other than the T-spot, like the GCCT and the syphilis screening and immunizations. Immigration screenings is another new type of appointment. Appointment code is IMMIGR. And again, it does not fall exclusively under the TB program, but we do cover the cost of the T-spot, the T-spot only. So just a reminder on documenting and coding for the short course 12-week regimen, 3HP. To prevent Medicaid or insurance from rejecting the claim, the reason for the visit and accurate documentation need to reflect the appropriate CPT code, E&M code, and diagnosis code. So when a patient comes in for DOT or DOPT without side effects of TB meds, it is not considered a nurse visit because all the nurse is doing is the DOT. So when you're in the TB9 form, there's a drop-down box at the very top on the general tab for select DOT or DOPT, document in the TB9 under the TB27 if they deny signs and symptoms or side effects of meds, and in orders and charges, they should have a diagnosis code and the CPT code H0033 for the DOT only. Only those two things. The E&M code should not be charged if they come in without side effects. So if someone does come in with side effects, if we're doing that 12-week regimen, we know that we're supposed to be screening them for side effects of TB medications or any complications before we DOT them. So if they come in reporting that they're having problems, they're having side effects of the medications, we're not going to give the dose. The dose is held. But it becomes a nurse visit because then the nurse has to take action. So on the TB9, under the TB27, accurately and descriptively identify their specific symptoms. Make sure you address the medications that are held, the labs that are drawn, and put a note that it will be record reviewed with the doctor. Under orders and charges, there should be a diagnosis code. The CPT code, do not use the H0033 because you're not giving the DOT, it's held. And you also charge an E&M code, the 99211, and whatever labs are done. So the visual acuity screening and the color vision screening, it was a little tricky documenting the results. So on the TB9, you want to make sure that you document the results in the little note box on the respective procedure. In the procedure order, once you order both of them in orders and charges, the visual acuity screening and color vision screening results are going to both be found in the same place under the order group details box. So you're going to be documenting both of them in the same box. So you'll open the results under the order group details window, click on result and text, and you're going to put your results there, and then OK, and you can close the order. Then same thing under the color vision screening, you're going to document, when you document the color vision screening, it's going to both fall, I couldn't get it on the screen right here, but this middle box, that's order group details window where you see visual acuity screening highlighted in blue. You're going to also see color vision screening right under that. They're going to both be in that same window. So you can click on one and document, and click on the other and document, and it saves together. So Jamie and I are going to be putting together a tuberculosis workflow refresher training. I'm getting a lot of feedback from a lot of nurses. I sent out an email yesterday requesting that you send me any specific things that you want covered, any particular topics that are troublesome or that you don't understand. Send either Jamie Woolley or I an email. Let us know exactly what you want us to cover. But we're going to basically go through from start to finish, just like we did in the beginning, almost a year ago when we started Entergy. We're going to go through different types of visits, step by step, and how to do resulting, ordering DOTs, what types of visits to document on differently. So this is coming in the near future. Jamie and I are going to get something together. It's going to be kind of like this, a Zoom PowerPoint, and we'll send out an invitation to you by email. So be looking out for that. And I hope this is for everyone who is interested in the refresher. It will be recorded and uploaded to Moodle if anyone is not able to attend that. Does anyone have questions about anything that I talked about? So I'm not seeing anything in the chat box. So if you didn't get the opportunity and you do have a question for me, please just email me, angela.blanchard@la.gov. Thank you.
So good morning, I'm Nora McCarstow. I am the Pediatric Statewide Nurse Consultant. And all of the recent changes to the CYSHCN section of the Clinical User Guide have already been presented to the CSHS field staff. So to summarize, nurses are using assisting provider accounts when working with the physician and when adding orders for the physician. We corrected some wording for the medical visit workflow and scanning results and attaching orders. And we also added the CYSHCN RN care coordination form. And so Michelle will go over the next slide.
Hi, this is Michelle DePlanche, CSHS Statewide Social Work Consultant. As Nora mentioned, all of the changes that were made have already been presented to the CYSHCN Social Work field staff. As a review, edits were made to the CYSHCN Social Work workflow for licensed clinical social workers. These changes include billable encounters for in-person visits, adding charges which are steps 11 through 15 on the social work workflow, and telehealth visits scheduled and based Entergy. We also added the social work care coordination workflow for all CYSHCN social workers. A few other changes that were made to the CYSHCN section of the user guide include adding a section for creating a CYSHCN correspondence and a section for families helping families referral process. We removed the CYSHCN parent liaison workflow. As many of you may be aware, we no longer have parent liaisons in our parish health units.
In the near future, we will be adding a few other workflows, which include nutritionists, speech pathology, genetics lab only, genetics parental testing, repeat newborn screening, and psychiatric workflows. These workflows will be reviewed by the super users and approved by the EHR steering committee before adding them to the EHR clinical user guide. And of course, we'll let you know when they're added. And that's pretty much it for us. And for CYSHCN staff, you know, you can always reach out to us. If you have any questions, we can go over anything with you.
We will move on to immunization. I do want to highlight this. You know, our flu season is coming up, and we all know that immunizations save lives. So please encourage your patients once we start receiving flu vaccine. The other thing that, you know, with COVID, well, actually many of our vaccines with COVID, we're seeing, you know, a decline. So please encourage folks. Hep A is, you know, something that's definitely still an issue in our state. But the flu vaccine is the next big thing that's going to be on your radar. And we are prepping for those MVEs. We will probably be doing the same thing that we did last year, where we'll be entering into the EMR the flu vaccines that we are giving, but we will not likely be charging folks the $10 admin fee. It sounds like just recently as last week, it was decided by leadership that we could waive that. But please be mindful that if they do have insurance, we do want to collect that information. So if they have insurance, please collect the information on the insurance, because we can put that through their insurance and bill for that. I know that most of you are aware that our state has spent a lot of money on COVID, so leadership just wants to be mindful that, you know, we're able to get reimbursement where possible. And so I have a short video that Tammy, who is driving the slides, will play for you now. It is a short slide that should update our immunization workflow. Hi, this is Deborah Even. I'm going to be reviewing the immunization workflow in the Entergy electronic medical record. So the first thing you're going to do is navigate to My Day. Now, I don't have any appointments set in here because I'm not in a live schedule. So here you would have your appointments. You would be able to see who is here, who is ready. You would find your patient in the list that appears here, and you would select the green check to the left side of their name, which should be around this side. You'd then select the exam room and select Save, okay? Once you click on the patient's name, their chart should pull up, okay? You're going to navigate here to medications. And so the other way that you can get into a patient's chart and start an encounter is by clicking Select Encounter, and you'll do New. If you do this and you're doing this to back enter a live encounter, you're going to want to select Billable Encounter here. For today's purposes, we're not going to do that. Make sure that you've always got a health center or location selected. And for today's purposes, we're going to do an immunization only visit. Okay, so now when I go into this med section, which will be your first step, I am going to have an option to mark as reconciled. So I could click this if they tell me that they're still on these two medications, or I could select this plus, and this plus will allow me to add a new prescription, add our medication they're reporting, or add a new request. And in this case, it's usually going to be add reported med. If they have no medications here, you're going to have a little square box, a rectangular box here that says set no meds taken, and you could click it, and this will show as no meds taken as of this date. For today, we're going to mark as reconciled, and you can see this highlights in green. The next section that you want to go to is to allergies. So if they have no known allergies, and this is more than their first time coming in, you're going to mark as reviewed, and this is going to set their allergies to reviewed. The next thing that we're going to do is navigate here to our note. And at this point, we should have already taken their vitals. And what we'll do at this section is we're going to enter a chief complaint here. We're going to type in immunization. Okay, that's why they're here. We will enter their vital signs, their height, their weight, their temp, and their blood pressure. Okay. After this, we can click Save here, and we're going to navigate to forms. For the immunization forms, you may see it pop up initially if you've used it recently, but you're going to navigate here to immunizations. And you'll find your nurse immunization note here. Please enter their date of their last menstruation if they're female. This is so that you can add other information in if you need to, such as if they're on birth control, that type of thing. You can enter if they have issues with blood pressure or if they already have this condition. And you'll need to enter here their smoking history, okay? And at this point, you can click Save again. And here, from here, we'll navigate away from Entergy for a moment. And what you can do is navigate, what you need to do is navigate outside of the immunizations in Entergy, and you're going to navigate over to your links on a regular web browser, and you'll enter your vaccine information there as you usually do, your lot number, your vaccinator, your route of administration, site of administration, and what type of vaccine it is, okay? Be sure to give your patient their vaccine information statement. In order to enter the immunizations into Entergy, from here, we're going to come over to this left side, which we call the dark side. You'll click on this little injector, and this will pull up either vaccines that were given in the past or a rectangular box that you can click on to pull up your vaccine schedules, okay? The first thing that I want you to look at is here under VFC eligibility, it says no data found. We never want this to say no data found. This is generally set at the front desk if they know they're coming in for immunizations. They will have had them fill out something so that we can determine if they're eligible or if they're not eligible, okay? One of these must be selected. For now, I'm going to select not VFC eligible, and I'm going to select today's date, and generally I will save, okay? Please be sure that you know where this information came from. If you don't have it, please get with your clerical staff so that they can update that. As you can see here, you've got different vaccine schedules. This is our pediatric schedule, and we have all our vaccines listed here. Sometimes we have combo vaccines that we want to give our patients. So I'm going to show the alternates so that when I click order, I have a little black arrow that points down that are going to give me those options to give the combo vaccines. Okay, once you select a combo vaccine, for example, if I click here in this box under the order, remember that I clicked on order down here. This is my order window. If I click here, when I give this vaccine, it's going to fill in a DTaP, a Hep B, and an IPV on this column. Okay, I'm only going to select that, and I'm going to pick one of my flu vaccines since that's what we'll be doing shortly. From here, I'm going to select Save. And now my ordered word is highlighted in blue, and as you can see, it has filled in each one of my combo vaccines and my flu, since this is considered the alternate. Okay? From here, you want to come back to the lower right-hand corner, click Administer, and your two vaccines will show up. You can select here, Administer All. At this time, we're not asking you to fill this in. You can fill this in. This will help, especially the amount, and we can work on filling in the units. So the amount, if it's not there, the admin site for sure, and you'll likely see funding source in all of your vaccines. Okay, so that's something that we have changed recently. Once you have these highlighted or checked off, you can click Save. You're going to get another pop-up window, and this is where you're going to do your charges, okay? So we've given two vaccines, and they were both injectables. So remember, you'll do your 90471 for your initial, and then your 90472 for your each additional. If these had been oral or nasal, you would have selected the appropriate here. If I had only done one vaccine, you would want it to be selected only in this first box. If I've done more than one, you'll want both. This is the box that is connecting your vaccines to a diagnosis code that will drop on your super bill. If for some reason you do not have a diagnosis code, you can select it, but please let me know if this does not automatically appear. Okay, so I've clicked save, and now I'm going to go back to, actually I'm going to go over to orders and charges to ensure that everything has filled in or flowed over the way I want it to. You can see I've got both of my vaccines. You can see I have an immunization admin 1 and each additional 1. Now, if I had 3 vaccines and I needed this to be 3 and I forgot to put it, you could right-click and open your details and change your units here to 2, okay? And vice versa. If you've made a mistake on the other side and you need to correct it on this side, you can change it by right-clicking. You can also remove this if this is the wrong vaccine or it's the wrong charge, but remember, you still got to go back over here to your immunization window and correct it, okay? For example, this now shows up as if I have already given it. If for some reason we are not giving this, then we would need to go in and void, okay? So all I did was click on it. It brought this window up, immunization details. I clicked on void, and it's asking me if I'd like to void this vaccine dose. And I'm going to tell it yes. When I do that, all the other alternates that it had filled in are now gone, okay? Remember, that is not going to leave your order's charges. You actually need to go in and tell it remove, and you need to remove your each additional. And now I've only got my flu and 1 immunization admin. Okay, at this point, we are essentially done. I've shown you how to void. I've shown you how to go back over to your order's charges if you do need to void. Okay, if you have already saved this super bill here using your lower right-hand button, and this is grayed out, the system will let you void even after you've saved it. But you can't remove charges from the super bill at this point. So please be careful. If you must delete a vaccine or any charges after saving the super bill, contact your supervisor or work with your clerical staff, or you can submit an OTS ticket. But really, your staff should be able to help you pull these charges off if this has already been saved. For today's purposes, I am going to remove both and ensure that this comes off. Remember, click it. Do not click your order button first. It won't let you void it. Remember to click your alternates here, because if you don't, it's going to not know where you're going. You're going to void here, and I will tell it yes. If you had left these vaccines on here and saved your charges and everything was correct, there's no duplicates, the only other thing that you would have to do is what you normally do. You'd save this and you would sign this, and that's it. Okay, I hope that was clear. I tried to be as clear as possible and go over some of the errors that occasionally pop up, or I don't know how often they happen, but I know those are the questions I've gotten most often. How to change adult flu vaccine. How to charge. So Jan, I actually can't show that to you because we went in and removed that no charge because we thought this year we weren't going to be able to waive it. So I need to get with Dana and add that back in. So I didn't show it in this video, working on the premise that we weren't going to be able to waive that fee. But that is probably, I am probably going to do a separate video for that, and I will let all of you know when that goes into Moodle, and I will demo that and do it separately so that we don't run into the issue of this being, yes, this year we're waiving it, no, next year we're not, and it'll be its own thing. All right, no problem. Okay, let's move in. I believe this is our colleagues from BHI. Let's move over to that. Let's see, Jennifer, is there a way to deactivate older versions of VIS info? You know, the VIS, I'll have to look at that, Jennifer. The VIS in this system, I don't know that we set it up. I know there was one region that did have some issues when they were audited by the immunization program. I need to look into that. I will note that and get back with all of you on that question as well. I did want to remind you for technical things, as you can see on the left-hand side, for technical things such as the scanning piece, which I hope we've straightened that out and that's been resolved. It's not intuitive, but that's the way it works best in Entergy. For those kind of things, system issues, that will go through the help desk. Anything else, as was mentioned earlier, first you'll consult your user guide. And we will have that if it's not up already on the Moodle, the most current version, and then we'll have a summary of what changes were made. First consult that, please. You can use your table of contents. It should be hyperlinked. If you click on it, it will jump straight to that section. If you still cannot find what you need, please go to your super user. And if your super user at that point doesn't know, then the super users for both clerical and clinical can go to their supervisors, which is the regional nurse manager, the RAM, or the ARA. And then from there, they'll bring it to me, and I'll discuss with the programs. If there's a major change to be done, you can see our workflow involves the steering committee and testing things out to make sure that everyone who is involved or needs to be involved or have visibility on the change is aware. We don't want to change anything without complete visibility of all programs, because if we change one thing and we break somebody else's workflow, that will not be good. So please keep in mind that we'll refer back frequently to this communication flow for issues, just so that we're all on the same page and we know what to expect when we can't figure something out. Next. Okay, and we are at the end of our training. Please go to Moodle, check off that you've completed this training. It's the easiest little checkbox that you'll ever do. And while you're in there, if there are other trainings that you've attended in person or you've viewed in the past, please check those off as well. Please keep in mind that now we have not just reproductive health in Moodle, we have all of the programs, anything that's come out, our SOPs, all of those are now housed in Moodle. And so Tammy's saying these will be uploaded by tomorrow. So go in tomorrow and check off that you viewed.